Hey, Arlene, sorry we ran so late, but
It's okay. I'm sure people were tired. It's an amazing meeting. I actually listened to everything all day and I was riveted. You did such an outstanding job, but I'll be really quick because I'm sure people want to get on to whatever their evening activities are. So I'll go through, I'll try to spend about 5 minutes, and then if people have questions, I have slides, but I'll flip through them quickly. I guess
very good.
share my screen.
We do have a number of people still joining, and we are live, so we'll give people just a minute.
Okay, I just got a message. You cannot start share screening while another participant is sharing. So.
I will stop my share and let you put up your slide. You should be good to go.
Okay.
There we go.
Okay.
So we have a number of people on, and I think in the interest of time, Arlene, why don't you get started? So I'll just kick it off. Once again, thank you to all of you for participating and hanging in there with us despite the technology and the overrun and everything. But I think it's been a worthwhile use of time, and we're going to be very pleased to hear our closing reflections for today from Dr. Arlene Bierman from Agency for Healthcare Quality and Research. Arlene?
Oh, thanks, Chris. So, what a day. I mean, I don't know I could give justice to making closing remarks to such a rich discussion. I was riveted and I listened to everything all day. And I just want to say a couple of words before I get started. I'll be brief because I know everybody wants to get on to their evening activities, but I do want to share a few things. But I'm a general internist geriatrician. I've done a lot of work around health equity. And I currently direct the Center for Evidence and Practice Improvement at ARC. And I have been in tears. I have worked in long-term care settings during the course of my career. And, what Maurice Miller shared and Lori Porter, it just really hit home. I really got choked up. And then, how inspiring the work that Faith Wiggins is doing. I'm actually the first one in my family to graduate college, and my mother worked as a cashier in a department store and was a shop steward and really fought hard for, better conditions for all of the workers there. So it was inspiring to see the work she's doing. And then actually, I just finished reading the book Cast. And I just said, I know Shanoy Wellington mentioned that, and everybody should read that book. It really opens your eyes on all kinds of level and all of the biases that we all carry. So I'm going to just get started and run through my slides really quickly, but I'm happy for people to reach out to me if you have questions or if there's other things you want to share. And I don't have to tell people about the tragedy of COVID. I think now it's over 65,000 nursing home residents have died. We know about the vulnerability, and we know about the challenges to staff, which we've heard today. And we've heard a lot today about equity. And a couple of things I just wanted to mention: that equity requires giving the resources to those who have less to be able to come up to others. And, and also listening to some of the discussion today, we've talked about racism and we've talked about other types of, biases and discrimination. And, one thing that struck me is the whole issue of intersectionality and how it really impacts, long-term care settings, ableism, racism, ageism, sexism. I'm not going to, I could go on. So I think it's just really exciting that everybody in this, meeting is really interested in finding solutions. We know that there's been multiple challenges in terms of COVID. I don't have to tell you this, but what I want to say is, with all the tragedy, I think there might be a window of opportunity. It's exposed the long-standing fault lines in post-acute and long-term care, and really the need for investment in resources and rethinking how we deliver care. ARC has recently launched the National Nursing Home COVID-19 Action Network, and I hope many of you are participating in this. And the network will provide training and mentorship to as many as 15,000 nursing homes across the country to increase implementation of evidence-based safety practice to protect residents and staff and achieve the following goals, which I won't go into now. I have the slides show some of the curriculum. There's a link here if you're not participating. If you're interested, please do sign up. But also, I think it's very important that this network actually addresses these issues of inequity and racism and these other challenges in long-term care. So I think if you could share your solutions with us at the end of the meeting or give input on our curriculum and how we could make it more responsive to some real needs on the ground, we'd really love to hear from you. This shows in the last 2 weeks, you know, we actually, it's amazing. We've already within basically a month and a half enrolled 7,500 nursing homes across the country. And these are dots of where, you know, people have participated in the last 2 weeks, and it's not up to date. There's a lag in the data. And this is a percentage of nursing homes attending one or more session by state. So you could see there's uneven coverage by geography. So if you can help get the word out to places that might not be aware, it's free to participate. It uses a model of telementoring with ECHO. So it's really helping, supporting people in being able to, you know, deliver the care that they would like and address some pressing issues, but also to learn from your peers and share solutions. I'm going to skip over this. I have the curriculum in here. The first half is really focusing on a lot of COVID specific issues and infection control. But in the last, you know, 8 weeks of the curriculum have things such as interprofessional team management, CNA, social isolation. And we're constantly updating this as new evidence comes out or new issues arise. So we really would like your input on this. We are going to be launching a coordinating center that's going to provide, you know, resources online that will be available to everybody. So stay tuned for that. I'm going to switch gears a little bit, and, you know, maybe I'm the transition between all of the great, you know, content about what the challenges are to solutions. But, you know, and at ARC, you know, our mission is really to improve quality outcomes, access of care, improve health equity, and get evidence into practice. And I think that, you know, post-acute and long-term care is a real integral part of the medical neighborhood, and the issue of care transitions, and thinking about ways that you could align with other work that's going on across the system to deliver patient-centered care. And ARC is also focused on improving, you know, the performance of learning health systems. And what's a learning healthcare system? It's one that's designed to generate and apply the best evidence for collaborative healthcare choices of each patient and provider to drive the process of discovery as a natural outgrowth of patient care, and to ensure innovation, quality, safety, and value in healthcare. This is from an Institute of Medicine report. And, you know, I see, you know, post-acute and long-term care facilities really can benefit a lot from becoming learning health systems. I know some of you are already. And at ARC, you know, we decided, you know, we needed a model for how we improve care. And I don't have time to go into this now, but we developed the care and learn model. And it really puts the patient in the center, and our job is to support them in achieving their aims. And, you know, but I think what's unique about this model, I have the reference here, is that it really integrates the caring part of healthcare, which is, you know, at the core of post-acute and long-term care, with the data-driven, you know, data analytics and quality improvement. And how can we put those two together to actually deliver the care that people need in a responsive way? And, you know, just the whole cycle of, you know, knowing what the evidence is, implementing it, and then generating new evidence from practice about what works and what doesn't work, and how exciting it would be if post-acute and long-term care facilities were the ones generating the evidence on how to do this right. I'm almost at the end. I'm gonna give you 2 resources that you might wanna tap. So ARC funds the evidence-based practice centers. There are 9 institutions across the US that do systematic reviews. And to do a systematic review, we have a partner who's willing to implement the evidence. So we do a lot of reviews for professional society who use them to create guidelines. More recently, we're doing reviews for learning healthcare systems who use it to really change the way they deliver care or inform their decision-making. So we'd be very open to getting nominations from this group if you think you could benefit from a evidence review and want to use the results to put it in practice. The other thing we're doing is actually ARC is tasked under the Affordable Care Act to disseminate and implement evidence in practice. And what we choose to implement is done through actually a public nomination process. And we look for topics where there's strong evidence for the practice, where there's a big gap in practice, it's feasible to change practice, and it could have a big impact at the population level. So, think about, are there topics that the group, as you do your solutions, might want to nominate to us for dissemination and implementation? And the good news is this work is funded through the Patient-Centered Outcomes Research Trust Fund, which has been on again, off again over the last few years, due to a number of challenges. But this year, actually, it was reauthorized by Congress for 10 years. So we have a solid funding stream. ARC should be getting about $100 million a year over the next 10 years to do this work, which adds up to $1 billion. So we're really excited to have 10 years to be able to invest and really make a difference. So we welcome your ideas as we shape the next 10 years of this program. Finally, I'm not going to go into these programs we're doing now around implementation, but what we learned is, implementation and changing practice is hard. I mean, there's been talk today about culture, resources. And what we've learned is when we want to change practice, we have a lot of evidence for what works in terms of the clinical care. We don't have evidence about what works about how to change practice. So we've integrated implementation science with quality improvement. And as we do these initiatives, we try to learn at the same time what works in terms of implementation. And this is my last slide. The distance between dreams and reality is action. And I'm looking forward to seeing all of the action that comes out of this meeting. It's been a real honor to be here and listen to all the panels and speakers today. Thank you.
Thank you so much, Arlene. We so appreciate it. I don't see a lot of questions in the Q&A. But is there anything before we wrap up that you would want to expand on for a minute?
No, it's fine. I'm sure people are really tired. I know I rushed through that, but I'm happy to, make my slides available. They have links on them. I really do hope you reach out to me at the end of the meeting to see how ARC can help you advance the solutions that come out of it. And feel free if people have questions just to, get in touch.
I do see one of our, Regina has raised her hand. Regina, you're live. If you unmute, you can ask your question.
That was an excellent presentation from all the panels. So I have a question with these initiatives that you just brought up. When are they going to be in place? Is there a particular date when they will be available?
So can you tell me which, these are all ongoing. It's possible to you could write, tomorrow you could nominate. There are ongoing programs of the agency. So it's possible now to nominate a topic for either a systematic review or for implementation. And if you have questions about how to do it, we can provide more information, but the links are on my slide. So if you click on links, and then if you have other questions, we can give you more information.
Okay, no problem. Thank you.
Very good. Well, if you could send me your slides, Arlene, I will share them on our website. In fact, all the slides from today will be available on our website in addition to the recordings from the session. So with that, thank you to Arlene, thank you to all of our panelists and presenters, and most of all, thank you to you, our participants, for hanging in with us. We have a busy day tomorrow afternoon where we will form into work groups and do the real work of this meeting, which is to begin to come up with solutions and potential recommendations for action. So be well, have a good evening. Thank you again, and we will see you tomorrow afternoon.